Hey, Good morning, Raj.
Please go ahead, Dr. Raj.
Hello, and welcome to our webinar. Welcome to all our audience and participants. Good morning, good evening, and good day. And it's greetings from the brotherly love city of Philadelphia in United States. I'm Dr. Raj Shah. I'm a practicing cardiologist, board member of the Wills Global Foundation, and chairman of the Wills Health Council. My health council is leading several transformational initiatives for rural India. Most impactful is our rural telemedicine centers, bringing affordable care to the rural population by using our sustainable and affordable HEART model. Acronym HEART stands for Healthcare Easy Access for Rural Communities via Telemedicine. It works this way. By donating one time up to $1,000 for hardware and training of a village resident as the Sahayak who triage patients, takes basic vitals, and connect them to the remote physician for video consultation. Patients pay a small fee to cover operating costs, which includes doctor's fee and Sahayak's fee for services, thereby creating a job for Sahayak. We have rolled out more than 300 telemedicine centers in villages in 7 states in India in last year. And we have a goal to create more than 10,000 centers in next 3 years. Additionally, we are undertaking newborn baby nutritional health through training breastfeeding techniques, and more on this in our next seminar in 2 weeks, providing affordable sanitary pads for young girls and women in rural India in collaboration with our partner Nova, and offer mental and behavioral health using yoga and meditation under the leadership of our Health Council Vice Chairman, Dr. Bindu Kansupara, and today's speaker, Ishan Shivanand, who is a member of the Health Council and has agreed to be the director of the program. Bios of all our speakers is available on our website. A word about WILS. It's an initiative of Penn IIT started in 2006 and incorporated as non-profit 501c entity in the United States, and also WILS Global India as a section of 8G Foundation in India. WILS mission, as inspired by late President Abdul Kalam of India, is to improve the lives in rural India by technology-enabled solution by engaging with IITs and similar institutions for innovation towards self-sustainable and scalable solution in 6 areas the acronym will suggest. That is water, health, education, energy, livelihood, and sustainability. And they all are, by the way, integral part of achieving holistic health as defined by World Health Organization as a state of physical, mental, and socio-economic well-being, and not merely absence of disease. And to achieve our mission, we work collaboratively with proven on-the-ground NGOs and other partners such as Mission Samruddhi, Jivika, Magan Sangralaya, Wind Foundation, EEE, CIA, SOBUS, and others. Some examples of exciting projects, each with potential to scale to benefit millions of people, are spring water rejuvenation in Himachal Pradesh, our telehealth programs, spoken tutorials to bring IT skills to masses, small village in Aravali, and social business and entrepreneurship in Pandharpur and Magan Sangralaya in Wardha. Please explore our website, www.willsglobal.org, for more information. WILS is a volunteer organization and depend on the generosity of many of our donors like you who share our vision of impacting 20% of India's rural and semi-urban population, that is 300 million plus by 2030. To pursue this goal further, WILS, together with Penn IIT, Stanford University, and Banaras Hindu University, BHU, will be hosting the 7th annual Ideal Village Conference in Varanasi from 11th through 14th November 2022. We have invited Prime Minister Narendra Modi and Chief Minister of Uttar Pradesh, Adinath Yogi, to address the conference. We are confident that they will grace this conference. The details of all speakers and the program are available at www.idealvillageconference.com. Today's event is part of our series of thought leadership events, which where prominent persons like our speaker today share their unique and inspiring perspective on a variety of subjects. Today, our topic is yoga for better mental health. Depression, stress, and many other mental issues can be prevented and treated through yoga, meditation, and other methods which are well documented in our ancient Indian practices. We have conducted over 20 such thought-provoking events during last 2 years, and you can find all of them on our website. A quick disclaimer: all views expressed by the speakers in this webinar are their own and do not reflect nor endorse by Wills Global Foundation or its board's member. Now, some housekeeping messages. All attendees are on mute through the webinar. You may ask questions to the speakers by entering in the Q&A box. If you need any help, you can chat with one of us by raising your hand or typing a request in the chat box. A recording of this event will be available on our website and on YouTube and Facebook. Questions from the audience will be curated and channeled to the speakers by me. It is now my distinct honor to introduce our moderator, Ambassador Pradeep Kapoor. He graduated from IIT Delhi in 1977 and joined the Indian Foreign Service in 1979 and attained the rank of Secretary in the Ministry of External Affairs of Government of India in 2013. Described as luminary diplomat, he was first in his batch to be appointed as ambassador in the year 2000. He first served as India's ambassador to the Kingdom of Cambodia and later as ambassador to the Republic of Chile in South America. He has written many books, including the latest Amazon bestseller, Beyond COVID-19, Leveraging Technology for Better Healthcare. He's on board. He's board member of Wills Global Foundation and is leading the Smart Village Development Initiative. He is frequent commentator on TV on matters pertaining to India's foreign affairs and security. He is currently professor at the School of Public Policy, University of Maryland. He himself is also an avid practitioner of yoga and meditation. I'm so proud to call him as my friend, and he's also a mentor. Welcome, Ambassador Pradeep Kapoor. Please take it.
Thank you, Dr. Shah. Thank you very much for your very kind introduction. And thank you for being such a great friend, which we are very proud of. It's a great honor. In the many webinars that Wheels has hosted, we have learned a lot about the policies, about the practices, about the processes, about the government aspects that become a basis for our own understanding and work in rural development, in collaboration with a lot of government agencies also, like the Ministry of Panchayati Raj, the Niti Aayog, the National Institute of Rural Development. In particular, in the field of healthcare, as Dr. Shah just mentioned, I had the great honor of writing an Amazon bestseller book, which was Beyond COVID, Envisioning a Better World by Transforming the Future of Healthcare, where we did touch upon the issues of mental health also, but not in such detail as is warranted, as is required, which we'll be doing later. But we have also focused a lot in our various webinars on various aspects of healthcare. We have explored India's adoption of Ayush, Ayurveda, Yoga and Naturopathy, Unani, Siddha, Homeopathy. We have had dialogues with the Secretary of the Ministry of Ayush and learned of the revival of these ancient techniques for everything from aches and pains to even treating COVID. And we are very blessed today that we will take this one step further. We will be learning about how yoga can help to treat mental health issues from Swami Ishan, Shivanandji. He is the founder of Yoga of Immortals. Yoga, of course, is a science which I have found personally in my practice is the best antidote to aging. And I'm very curious to learn more about this Yoga of Immortals. I have been having a lot of discussions with Shri Ishan Shivanandji in the last few weeks, and I've learned a lot already, and I look forward to learning more. He takes us to the early meaning of yoga, union in Sanskrit, merging with the infinite. The Yoga of Immortals program by Ishan Shivanandji addresses professional burnout also. Is structured, very well researched, non-pharma, provides countless healthcare workers the support to mitigate such issues as insomnia, anxiety, stress, depression, and all this adds to better mental health and well-being for the individuals concerned. His background and bio are in the banner. Further details can be seen in his website, ishanshivanand.com. We are very proud that Shri Shivanandji is a member of Wheels Global Health Council and also the director of Wheels Mental Health Initiatives, and will be amongst our prominent speakers at the November 2022 Ideal Village Conference. We encourage all of you to learn more about this conference. You can go to idealvillage.com and see the details and register for this. This is on November 11th, 12th, 13th at Banaras Hindu University, and it is choreographed together by the Wheels Global Foundation, by Stanford University, by Banaras Hindu University, in collaboration with the IIT ecosystem, in collaboration with Pan IIT USA, with Pan IIT India. So we look forward to having a lot of you get actively involved in this Ideal Village Conference and participating and contributing significantly, because the effort is not to have just a conference. The effort is to convert this into a movement which will impact the lives of at least 20% of the rural population by 2030. That is a very big goal. 20% of the rural population is 897 million people, 900 million people. That is more than the population of the Western world or the population of the entire North America and South America continents put together, two biggest continents put together, and the rural population of India is more than that. So impacting 20% of that population is going to be a stupendous task. So we want to convert this into a movement. But for this, we need participation by all of you. And we look forward to that. Please see how you can contribute, how you can participate. And we will look forward to discussing more of those details as we go along. But mark your dates in your calendar. November 11th, 12th, 13th in the most beautiful city of Varanasi, also called Banaras, Kashi, at the most iconic Banaras Hindu University. Now, without further ado, I know we are all waiting to hear the great man speak. Ishan Shivanandji, a very learned, cultured, literate practitioner of yoga. I welcome you. Over to you, Ishanji. Thank you very much.
Namaskar, Ambassador Saab. Namaskar, Dr. Raj. Namaskar to the esteemed panel, and my salutations to all the wonderful people who are trying to bring a health renaissance in our dear motherland. As I begin, let us try to take 2 deep breaths. Inhale, and as you exhale, try to bring a deep sense of gratitude to all our ancestors through whom we have developed these sciences that we will use to help our country. Take another deep breath. And as you exhale, Let there be a hope for the future generations to continue the legacy of our great ancestors. So even our future generations can experience the prosperity, the health, and the academic brilliance that once was, it still is, and will always be. Fantastic. Let us go on with the agenda. Before I continue, I would like to share with you that after the pandemic, the mental health of our country has been adversely affected, just like of the whole world. Not to say that the mental health of our country was doing extremely well before. Even before the pandemic, we had one of the highest suicide rates. We had one of the highest corporate burnout rates. In fact, if we look at a study by the National Crime Records Bureau and the Lancet report, we will see that almost 153,000 suicides were recorded, increased by 10% in the year 2020. And this suicide rate is in between 2016 and 2020, so almost 4 years. We can see that things were on a downward trajectory. The corporate burnout rate of India presently is at 29%, and there has been a sharp rise in anxiety related disorders. Now, anxiety is something that we have to take really seriously, because it is a precursor to a lot of mental health disorders. Anxiety, chronic, can lead to physiological issues. Chronic anxiety can lead to depression related issues, and if the chronic anxiety occurs, it will start to impact the quality of life, the sleep patterns, and that is when there can be substance abuse disorders as well, and which is again quite a major problem in India. Now, the data that we have is from populated pockets. What is the trustworthy data in rural India? We do not know, because till now, I do not think something on that great level has been done where we can procure a proper baseline image of what the issues are. But we definitely know that all the data presented right now, which doesn't seem that positive, the real situation has to be a bit worse, because the statistics of health and the statistics of stress related disorders and deaths caused by chronic conditions is increasing. So it is very important that we start to take mental health extremely seriously. Now, whenever we are talking about mental health, there are two approaches that can be taken. The first approach to mental health is let the issue come on the surface. Let the issue become severe, and at that time, a pharmaceutical intervention can be provided. Now, that can be a challenge in rural India, because how will we get the trained psychiatrists? How will we get the trained professionals? And then again, how will we get the pharmaceutical interventions to all these various parts of the country? Because even if we look at the urban population, we still have one of the lowest rates of mental health professional, the psychiatric professionals, to the general population. So pharmaceutical health is a bit difficult to procure and provide. So then we have to look at the tools that we have in hand. The other tool that we have in hand for mental health is a preventative, promotive approach. And even if there is a psychological issue or a mental health issue, we have the approach of non-pharmaceutical interventions. So in the year 2020, we wanted to study the non-pharmaceutical intervention of yoga and meditation. Here I want to be distinctly clear that when I say yoga, I do not mean that general image that the Western world develops when you are thinking about yoga, which is a person exercising or a person stretching or a person doing asanas. When I say yoga, I mean low impact, cognitive, psychological interventions that are provided that are more of meditative nature. Interventions that can work on the endocrine system, that can work on the parasympathetic system and the sympathetic nervous system. Interventions for which you do not need any denominational stimulation, meaning these interventions are non-theological, non-denominational, and can be practiced by any person, and they have almost a zero impact, meaning a person can be old and still these interventions can be provided. So please take out the image of a person doing yoga asanas in a gym class and put in your mind the image of a sage meditating on top of the Himalayas, the real precursor of the yoga modalities that we may be aware of. So in 2020, we wanted to do that research. We partnered with the University of Cincinnati. We partnered with a group of data scientists. We partnered with a group of psychiatrists, psychologists, and multifaceted study we did. And in that, we wanted to measure 4 scales. The scale was GAD-7, Generalized Anxiety Disorder. Then there was the PHQ-8, which was the depression scale. ISI, the insomnia scale. Now again, insomnia cannot be called a mental health disorder. It is more of a behavioral disorder, but it is a very, very important thing that we study, because a lot of substance abuse disorders we have seen are self-medication. And one of the biggest reasons of self-medication is when a person doesn't know how to relax, when he is not in control of his emotions, his endocrinology, his stress hormones are to that peak, his heart rate, his mind, his thoughts are all getting away from him. And chronically, these things have shown to create degenerative disorders of the brain. Now studies are coming up that lack of sleep, lack of the ability to relax is associated with so many brain degenerative disorders like dementia, Alzheimer's, etc. And hence we wanted to even inculcate the ISI scales. Then we wanted to also inculcate the HRQOL, health related quality of life scales, the SPF 12, meaning in a way how happy that population is. And as you all know, 2020 was the year when we were all locked in. We were all extremely stressed. So the baseline was furthermore corrupted than it would have been on, let us say, 2019 and 2016. Once we had the scales ready, we needed to study, and the population that we collected the data from, there were 11,000 people participating. Of that, a major chunk was from India. We made sure it was a homogeneous population, meaning 50% male, 50% female. We made sure it was a young population, meaning the majority of the data comes from 20 to 35 year population group, which is extremely important, for India is one of the youngest nations on the planet today. And we did that study for almost 6 months. Now, a few points here that I must share with you is the whole study was asynchronous. The whole study was software based. The whole study, not once we had person going or a person leading a meditation group or a person leading a yoga seminar. It was all done through software. The data collection was done through software. The interventions provided were through softwares. After the 6 months, when the study was done, I would like to share with you, and if you would like, you can even Google Yoga of Immortals, and you will see a lot of scientific papers that have already been published in peer-reviewed journals. 6 papers have come out. A lot of medical community has been excited about these studies, especially because they are of a non-pharma nature, and this really helps even the medical system because it takes away the load. In a place like California, which has a GDP greater than India, the mental health system is in a state of shock right now. If a child has anxiety related disorders, he will not get the help he needs for almost 5 to 6 months. So even the government is trying to pass on the laws to provide more and more non-pharma interventions. Anyways, after the study, we found out that from these 10,000 participants, 72% saw that there was a moderate to severe reduction in the depression symptoms. 75% quoted a decrease in generalized anxiety. Now again, this is COVID time. No nutraceutical intervention was provided. No pharmaceutical intervention was provided. This is all extremely well designed, researched interventions that were provided that were of a meditative nature. 77% said that there was an improvement in the quality of life, and 82% quoted that there was a reduction and normalization of sleep patterns. 82% people could feel happy, relaxed, and go to sleep peacefully. This data is phenomenal for us because number one, it shows that these interventions in a non-pharma manner are extremely relevant for a country that is dealing with mental health decline. Number two, this data shows that through asynchronous software-based methods, we have the ability to reach rural India. If through the Wheels Sahayaks, we can create an app or softwares through which these interventions can be taken to various parts of the country, and these interventions can be made in various languages, because right now when we did the research, we had these interventions in only 2 languages, English and Hindi. But imagine if we can get them in the various regional languages and provide it to the nation. What a beautiful impact we would be able to create. 82% reduction and improvement of the sleep patterns, 77% improvement in quality of life. Because we have to understand, even when in 2012, when the farmer suicide crisis was at its peak, even before it is a political issue, even before it is a financial issue, it is always a mental health issue. And if the mental health interventions are provided at the right moment, and the right moment is always preventative and promotive, then maybe our nation can protect itself from what we like to call the slow bleed. And I won't dump that data on you right now on what is the impact, the financial, the economic impact of mental health disorders, because all of us here are quite academic and we have access to Google Devata, so we can always download that data. But it is a slow bleed because developing nations like our country cannot afford a 29% corporate burnout rate. We cannot afford mental health disorders, because I want you to think about the tangible and intangible cost involved through mental health disorder. Because if we are just talking about burnout, then it will lead to absenteeism, it will lead to chronic fatigue, it will lead to decrease in output, it will increase the cost of spending on preventable lifestyle disorders. And when we already have the data and we have these modalities, these well-designed, well-researched and already implemented modalities, these modalities have been thoroughly implemented by the top HCPs and HCWs around the world, the healthcare workers and healthcare professionals. Because I believe in three things. I believe in a correct design. The design is extremely important, because if I'm being very honest with you, very, very honest, the field of yoga and meditation presently is one of the most exploited and least regulated field. Meaning anybody can come up and claim to be expert and say that let us do yoga. And by yoga, I mean, again, the physical interventions are provided and not the cognitive interventions. And we have to go beyond just the asanas. We have to really explore the science that our ancestors wanted us to learn about, the brain chemistry, the endocrinology, and maybe even what Ambassador Pradeep said, understanding the DNA, the chromosome, the telomeres. And right now, the data is very, very promising. Maybe even in the future, we can talk about longevity. But right now, we have to understand that this field is least regulated, most exploited. And through Yoga of Immortals, we wanted to reduce the margin of error and have well-designed, non-denominational, non-theological protocols that are provided to the public. And even before we are providing it, these protocols should be well researched, which they are. We have been published in the last 3 years in the top medical journals, psychiatric journals. And again, not alternative medicine. This is integrative. Alternative would be homeopathy, acupuncture. Whereas we do not have the means for an integrative approach, so we try to explore other things. But in India, we have the power of native medicine modalities, traditional medicine modalities, psychological medicine modalities, and yoga as a form of psychological medicine, as a non-pharma intervention, is one of the most beautiful that we had the power to implement through softwares. And we found through our research that it really, really benefits. And most importantly, these modalities have already been implemented and practiced and accepted by the HCPs and HCWs around the world. We have run our pilot programs in Mauritius, in South Africa, in United States of America, and we have done our studies in India. So I think it is a perfect time that we should start executing and taking these interventions to the rural population. And that is very, very important, because what I see right now in the Western world is that these interventions are well accepted and appreciated, but they have become a bit elitist. Meaning in places like North America, only the richest have access to these well-designed research interventions that are of yogic nature. I think it is time to take out the elitism from this and take it to rural India. And that is what we are trying to do. And I would like to share with you that I'm proud to announce that we've already started work on development of that software. We have already started to partner with how to bring these standardized parameters to create a baseline so that anywhere where the wheel sahayak are going, they are providing these interventions. Before these interventions are provided, if basic scales of measurement are provided, and these are questionnaires, these are quite easy. We were trying to partner with a few national agencies in India, but that has been an interesting uh, revelation of sorts. But anyways, we are trying our level best to have these scales so that there can be a pre-measurement, there can be an intervention implementation, and then there can be a post measurement, after which we can have tangible data to see how we are helping the rural population, and maybe even understand, because as I said, there is not a lot of factual data being provided right now. And once these interventions are provided, I'm sure even if we are able to make a dent in this problem, it will have major consequences for the growth of the nation. Because if we look at the economic impact of the data, it is huge. And that economic impact, even reduced a little bit, is the resources that the government has to re-implement towards education, towards health, towards building of critical infrastructure that our nation really needs. So thank you so very much. This was my presentation. This was my vision, and extreme gratitude to Dr. Raj Shah and Dr. Bindu Khansupada for believing in these non-pharmaceutical interventions and helping me take them to rural India. For that is the real lifeline of our nation, our potential. And I believe we will do great things together. So thank you, the Wheels community. And as Dr. Raj Shah said, we need your help to make our dream a reality. In the words of Dr. Raj Shah, if you can bring in Tan Man Dhan, and in the words of our great ambassador Pradeep Kapoor, talent, treasure, and there was one more word which I seem to
Time.
have forgotten.
Time.
Time. I'm sure we will do great things. So thank you so very much. I'm open to any questions that our moderators or our esteemed guest may have. Thank you.
Very good. Thank you so much, Yogi Ishan Shivanandji. Such a great layout of the discussion, the premise, and the basis of all the work being done, and the future potential also, and the necessity in this world. So, and we have seen the mental health issues increase all over the world, including India, including USA, including any other country of the world. But not only mental health issues amongst the general population, but also amongst the healthcare providers also, the physicians and others, including the mental health care providers. So we have some questions already.
Yes.
And along with Dr. Raj Shah, we will get into those questions. But overall, what I'd like to know from you before we start discussing those questions is, what is the role which, the spiritual gurus of India, like Yogi Ishan Shivanandji, Shri Ravi Shankar, Ramdev Baba, and so many other leaders who have been working on this aspect also for a very long time and are continuing to work and spread yoga and the message of yoga, the message of better health, better mental health. How can that impact be amplified and magnified?
Sir, I was born in an ashram in India. For 20 years, I was in that ashram. And I am from the Shaiv community. I'm a Shiv yogi, and we come from the concept of Kashmir Shaivism, which is a very ancient tradition of philosophy. Our great lineages Abhinav Gupta, Gorakhnath, Matsendranath. And in our lineage, we are householders. So meaning at a certain age, we do get married. And when we get married, life becomes interesting. So when I was in that ashram, in a small community, my wife asked me, what do you want to do in life? That's what women do. They make you think. Otherwise, men would have just been barbarians. And I said, I want to help the world. And she's looking at me and she's like, Jungle mein mor nacha kisne dekha? And that made me really think that I am here. And in the ashram, only two type of people comes. The ones who are fed up with life. At that time, I'm sure everybody's experience is different. But the people that I saw, the one who are fed up with life or the one who are about to die. And I realized that what she said really means a lot. I must go out. I must spread this knowledge, because knowledge needs to be spread for it to grow. Otherwise, we will go extinct. And when I came out of the ashram and I started teaching around the world, I started to have an academic approach. I realized that a lot of people are stuck in a micro ecosystem of their spiritual community. And that spiritual community, till the time the gentleman remains the spiritual leader, that community is good, it thrives, it's well. And when the gentleman passes, the community sort of implodes on itself. And we have data of about 200-300 years to see how a community can implode and how a community can divert from its true intentions that the leader had. And I realized that we have to break from this person-centric approach to a science-centric approach, because that is what it was taught in my community, that the guru doesn't matter, the vidya matters. The acharya is not because it is a cult of personality. The acharya is because of the wisdom that he has. So if you want to respect the wisdom, appreciate the guru, extremely nice. But then the guru's job is to make that wisdom into a progressive scientific research-based science. And then it is the job for the guru to make other people who are very well capable to spread this knowledge. And that can only happen if we break out from this whole concept of cult of personality, that is the person, that is the savior, that is the messiah, and I am just here until the time that person is spoon feeding me. I'm fine. And when that person goes away, I need somebody else. And that is what I am trying to do right now. I am trying to break from this whole concept, from this gravity, to bring the real sciences to rural India, because education matters. We must understand what even Shankaracharya, the great yogi, was trying to do, was make our wisdom like it was during the time of Nalanda and Takshashila, which is subject-oriented, science-oriented. And that's what the great philosophers did, like Sushrut. They never said, worship me. They always said, look at the science. Let's go, let's accept the science. That is what Patanjali did. Look at the science, look at the philosophies. They were great scholars. They were great academics. And I really appreciate what the wonderful organizations have done for the nation. And they will help, because right now, India needs all the help that it can get. But for future, as the time progresses, I would really appreciate and love if we can have an academic approach to these sciences. And I think that is where we will see the maximum growth in a long term. Otherwise, movements come and go, they will implode. And I do not want that to happen, because people have done such great work. The foundations that you mentioned, they have done extreme work. And I would love for that work to continue, even beyond personality. Yes.
Thank you so much.
Okay.
Thank you, Yogiji. I'll 1 second, Dr. Racha, before I hand it over to you. We have promoted all the participants to become panelists so that they can interact actively and we can have a lively discussion. Before we start off with the question answers, of which we have quite a few, I would request Dr. Raj Shah to come in with your intervention.
Thank you, Pradeep ji. We have some questions, and we have questions that I would also ask. But let me begin by saying we are so grateful that organizations like yours have begun a so-called scientific, research-oriented studies to bring yoga and meditation to the mainstream in America. I know it has been a mainstream and accepted in India, but Western world only accepts when it is proven. They want proof. Even though 2000 years ago, Hippocrates, so-called father of allopathic medicine, he clearly said about illnesses that there is mind over matter. There are psychosomatic illnesses, and most of the chronic illnesses have psyche as the basis. So really, by bringing this modality, and as you say, integrating this modality in our healthcare offering, would bring a tremendous improvement, because our mental state of our mental health greatly affects the bodily illnesses. Now, in this area, in America, this is becoming a mainstream as a part of integrative medicine offering. And there is one person who is passionate about it, who has accepted it, who knows a lot more than me, is Dr. Bindu Kansapara, who is our vice chairman of the Health Council, and who initiated the mental health in our offering. I'm going to ask Bindu to shed a light. What is the status of yoga and meditation as coming in the mainstream of America? Please unmute and give your thoughts, Bindu.
Thank you, Dr. Shah, and thank you, Ishanji and Pradeepji, for bringing
Thank you,
this excellent perspective, which is very important for current state of medicine in the United States. Just as Dr. Shah asked me, this movement started by Maharishi Mahesh Yogi in 1950s, and then the physician like Dr. Benson in 1960s at Harvard, and Dr. Andrew Weil at University of Arizona started promoting this ancient integrative approach. And that time it used to be called alternative medicine. Then we started combining contemporary medicine with alternative medicine. We call chem plus alternative become integrative. And as Ishanji mentioned and Dr. Shah is mentioning, unless we accept evidence-based research, mainstream would not accept. And as Dr. Shah and most of doctors who are attending, we know we have come a long way to take care of acute problems by contemporary medicine. We can fix the heart by coronary artery blockages by bypass surgery, but we cannot reassure the patient you will not have recurrence. So what integrative healthcare is trying to do is mind-body medicine combination along with non-pharmaceutical intervention, science of love, science of prayers, art of music. They are all called pillars of integrative medicine. United States government started this new agency called NCCIH in 1991. The budget for research is 183 million this year. And they have found, regarding Dr. Shah's question, yoga and mindfulness meditation has found highest benefit for substance abuse prevention, chronic pain management, including opioids. And there are all data you can find on NCCIH site. One of the reimbursement issue came up about talk, and it is good thing to share that contemporary changes which are happening is value-based purchasing in ACO concept. So people are going to get, organization like ACO will be getting paid money in bulk, then they will be share revenue. So for example, 100 doctor groups get $10 million from Medicare, and you save, you'll be able to share. That time, this non-coding approach would be allowed to get benefit, and providers can keep the money. Mental health disorders, as you know, is 50 million people in the United States are suffering right now. And the best approach is evidence-based medicine, which is what Dr. Ishan Shivanand has done, which will be very helpful. Now, what I want to just share two things as a cardiologist and reimbursement expert. Dr. Orni's program, which is he learned from Indian guru many years back, and Dr. Dean Ornish is internationally recognized. Medicare approved his approach, non-pharmaceutical intervention, including nutrition, daily exercise, science of love, prayers, and 72 hours of this training, they get paid $9,500 for approved Medicare side. So I think there's an opportunity for people who already have cardiac issue. They can join the Dean Ornish program and they can get reimbursed. Certain insurance like United Healthcare pays for it, Blue Cross pays for it. And how to get provider get benefit for yoga, and that is the difference. When doctors who are licensed and integrated healthcare doctors, they can prescribe yoga as a medicine for chronic pain, mindfulness, etc. Then they will be able to take them advantage as HSA deduction or FSA deduction, and Medicaid approves for group therapy for all these things, not as individual doctor, but for group therapy, they approved. So I just want to share how the innovation is happening for this field. And there's a lot of things. Now, regarding we doctors need to be certified. So Dr. Shah had asked me to share the things. As Ishan said, there's no yoga teachers are not regulated in the United States, but there's an institute called Yoga of IAYT. They are coming up with this first board examination next year. Ayush has already started with the certification of 6th level of yoga certification, which can get evaluation. But I think when doctors are certified, which API has started getting yoga training 200 hours, it will be helpful. How can Wills make a big impact on this one? I think Indians are already spiritual and their science of love is very common, so we have less depression. And as Ishan mentioned, there's a lot of data on non-pharmaceutical intervention by neurohormonal and neuropsychiatric and neuroanatomy functional medicine research. So I think there's a great opportunity for Wills to get into integrative healthcare, and Will has main purpose of serving our Matrubhumi and Karma Bhumi. So I do believe with the integrated research approach, multi-center, multi-country, we have a lot of opportunity with Wills. And as Ishan mentioned, Kananji can convert a lot of his teaching into different languages, so we can reach people who have social determinant of health issue. So I really appreciate giving me platform about integrated healthcare, which is very important. Just last statement, there are 10 plus fellowship program for integrated healthcare doctor, which requires 6 years after 4 years of medical school in the United States. And, it's a great opportunity for all of us to learn and get certified in yogic teaching and yogic breathing. Thank you, Dr. Shah. And thank you.
Thank you, Bindu. Your passion just bubbles out when you talk about integrative medicine, much more than you as a cardiologist. We talk about cardiology, but thank you for sharing that information. And to make our point of research, recently Prime Minister Modi, with chief guest director of World Health Organization, they inaugurated a Ayush Research Center in Jamnagar, Gujarat, India. This will bring about all the aspects of research of Ayush modality, which Ambassador Pradeep Kapoor said, Ayurveda, Unani, yoga and meditation, Siddha, and homeopathy. So the stage is set, and very soon we'll have convincing evidence, which is of course already known through so-called thought theory from our sages, that yoga and meditation has a significant role in improving mental health. Now, there was one question about how yoga and meditation will help to address the epidemic of addiction with alcohol, drugs, substance abuse, which often leads to overdoses and death. So I'll address this question to two people. One to Pradeep ji, when he studied, when he wrote the book on COVID-19, and he explored this in his book, the extent of problem that occurred particularly during COVID, and then how, Ishanji, then you will answer how yoga and meditation and our program will help.
Thank you. Thank you,
Pradeep ji?
Yeah. Thank you very much, Dr. Raja. I think I will defer to Yogi Ishan Shivanandji. And the question also, one of the questions is by R. Praveen Kumar related to the same, point which Dr. Raja has made. In rural India, alcoholism is a great problem along with drug addiction. How do we address it? So I have lots to say on this, but I would first, defer to Ishan Shivanandji to go ahead. You have to,
Wonderful, sir. Yes. So first of all, before I begin alcoholism in India, let us talk about alcoholism in United States of America. If we look at the US of A, we will find that the rehabilitation industry is one of the biggest industries in United States. It's a multi-billion-dollar industry where people go to rehabilitation programs that could be a 30-day detox inpatient or multi-month program. And I was surprised to find that for all the scientific marketing and advertisement that is done, most of the rehabs are based on a 12-step program that is a theology-based program. And in that 12-step program, it is all about bringing a higher power into your life. And I was quite surprised because it has been marketed as a pure and clean science. And if we look at mental health, one of the easiest ways of getting insurance-based backing for mental health is substance abuse disorders. But then again, as I would like to say, beyond the pharmacological detox, a lot of the programs are dependent upon theology-based 12-step programs. And that is why the success rate is only 8 to 10%, meaning people who spend a lot of money, it's called a revolving door rehab, meaning you go in, come out, relapse, go in, relapse, come out. It's a revolving door. So a lot of the people get stuck in the system and the right interventions are not provided. So much so that now the physicians, the clinical psychologists are starting to understand that we cannot just see substance abuse disorders as a physiological predicament. We have to talk about the big psychological elephant in the room. We have to talk about the reasons for addiction, the mental trauma associated with addiction. We have to talk about the psychological issues that led to a person being an addictive personality in the first place. This is extremely important because this takes into perspective first education about the mind, second education so that the stigma of addiction can be removed, and that whole concept of taking addiction as a moral failing, it can come out, and third thing, that even the theology can be removed from this. As you can see, the West has tried the 12th step. It has to be very, very scientific, and we have to understand the cognitive aspect of the whole criteria. Now in India, this education is extremely important, especially rural. I'll give you a case in point, and it's a funny case in point. I remember when I was in the ashram, there was this young girl who was very, very stressed, in a state of anxiety. She was suffering through panic, so much panic that she would just you can, if a clinical psychologist would have seen her, they would have said, oh my God, she's suffering from PTSD, so much panic is there, and what is this behavior? And when I was talking to this girl, she told me that her neighbor had done Vashikaran on her. Vashikaran means love potion, stupid Cupid, that you make somebody fall in love with you through black magic. Now, this girl was a normal 20-something-year-old girl, and the gentleman who was living next door was again a handsome 22-year-old gentleman. And I said, why do you think that you are going through Vashikaran? And she said, because when I look at that guy, I feel attracted. And I'm not supposed to feel. And when I went to my parents that what is this feeling, what is this happening inside me, I was told it is Vashikaran. So there are misconceptions about the most basics of human biological responses, and if not addressed, education not provided, and this is a very small thing what I'm talking about, just to lighten the mood, but I want you to think, when we repress so much of emotions, when we repress so much of the society, when we repress so much of our mental health disorders, sooner or later, when a person looks at booze, it will be a quick fix. And so many people you will find in rural India are looking for that quick fix. And if the education, the mental health education and interventions are provided, person can feel good. In my personal experience, a lot of the times when people were able to get rid of their habit through meditative interventions, it was because they were very high strung, they were in a state of extreme panic, and they did not know how to relax. Something as simple as not knowing how to shut down your mind, how to relax, they become dependent on a substance. And through that meditative intervention, that yogic intervention, and again, I would like to highlight again and again, a lot of the things that we are talking about, they are not the asanas. A lot of the standardization that Bindu Kansupala, Dr. Bindu was talking about, is asana focused. This is not asana. This is the meditative, cognitive, psychological impact, low impact interventions that I'm talking about. When they were provided, a person could become relaxed, a person could become peaceful, and slowly we could wean them off the substance. And again, I said, slow and steady through education and intervention, it can happen. And yes, that is where I feel meditation is a very powerful tool that can be provided. But as I said, it has to be a holistic approach. We cannot just give the intervention to the sufferer. The interventions have to be provided to the family, to the society, to remove the stigma. We cannot just provide these interventions as the only intervention, because if a person is a chronic alcoholic person, I would really recommend an integrative approach, because then going cold turkey is not advisable. There has to be a much more broader aspect. And if I feel we are thinking as an organization to provide this, we should think more about as a preventative and promotive solution before a person goes towards addiction. But if we are going towards hardcore addicts, yes, it has to be integrative, it has to be a social approach, and it has to be a very, very informative, carefully well thought, curated approach. Otherwise, it can do more harm than good. Yes, definitely. But preventative, phenomenal. We have the means to help.
Thank you. Thank you, Shanji. There are two people raised hand. So the first one was Kiran Deshpande. I'll ask you to unmute if you want to say something, followed by Ashok Batra. Kiran, please unmute and say.
So if there is any delay in that, there's Prakash Malik who had raised his hand, but we have questions by Prakash Malik on the question answer. Now, one thing, Ishanji, thank you for the very comprehensive answer.
Thank you,
The focus
Ambassador.
of Wheels is basically in the rural population, firstly. Secondly, leveraging technology for impacting social health and social, aspects of life. Thirdly, the WHEELS as an acronym stands for W for water, H for healthcare, then E for education, E for energy, L for livelihoods, S for sustainability. So here he has asked, Praveen Kumar had asked about rural India. Alcoholism is a great problem along with drug addiction. How do we address it? So that does fall under the ambit of WHEELS healthcare in rural India. So we have to give it a lot of thought. There have been some very successful examples of, for example, in Jharkhand, there's a very good civil servant, Siddharth Tripathi, who has done phenomenal work of controlling alcoholism through dialogue, through discussion, through women power, etc. So all those issues do need a lot of attention, because along with COVID and the isolation and the work from home, I guess these sort of problems have also increased due to depression and other aspects, and they will require very serious thought and action to reduce and control and manage alcoholism in rural India, particularly along with drug addiction. Drug addiction also has many other ramifications, cross-border, financing, terrorism, etc. That's a whole different topic altogether. So we will not get into those details. But if Dr. Racha, you permit me, I'll just read out the question by Prakash Malik, because he had also
Sure,
raised
please.
his hand. It has been estimated that as a result of COVID-19, almost 40% of Canadians have mental health issues. Recently, the Canadian Mental Health Association reported that a large percentage of physicians are suffering from mental health issues. Some have quit the profession, and tragically, some have contemplated even suicide. We are grateful to Ishan Shivanandji to present this webinar for our benefit. Prakash Malik, Banaras Hindu University, 1960, from Edmonton in Alberta, Canada. So there's not a question, there's a comment, and it's a fact also. Even in the US, there was a big meeting recently where the statistics were also discussed about the impact in the mental health, or about mental health on the healthcare profession itself, as I mentioned earlier in my comments.
Yeah.
Now, Beena, would you like to go ahead with the next question, Raji?
No, I was just going to read the question. One of the comments and question came about which Mr. Prakash Maulik mentioned, the problem in Canada. That's a problem all over the world. And pharmacologic treatment is really very short term and usually non-effective in long term. So our yoga and meditation really is the answer, and we have to bring it to the physician world and to the general population through such webinars, such lectures, such gathering, etc. So we really appreciate your bringing that for the audience to listen about your mentioning Canadian Medical Association.
So Kiran
The-
Deshpande is here.
Good. So
Should we
Kiran,
ask
if you had question.
Yes. You had raised
Go
your
ahead.
hand. We have your question. Otherwise, we'll go on to the next questions as they appear in the order they have come in. Okay, so while he gets ready, I will just read out the statement by Beena Sangani, that she says that I was fortunate to be part of Yoga of Immortals research and experienced infinite beautiful changes in my life and those of my colleagues. Thank you, Ishanji. We are so proud to be part of Ishanji Vision and now Wheels as well. Thank you, Beenaji. We are very happy to have you as part of the Wheels, family also, and look forward to your active work with Wheels. Prakash, yeah.
I was just going to read comment from Professor Kannan Modgalia, about students in India who are under a lot of pressure. Ishanji, will your approach be useful to address this problem? Has any study been conducted in this area? And I think
Yes, sir.
I would
This is
ask you to comment, Ishanji.
this is extremely important, Dr. Saab, the students, because we started a program a few months ago, under which we were focusing on STEM students. As of now, we are providing YOI interventions to 29,000 STEM students around India. There are two engineering institutions with which we have already partnered with. One is Neotech Vadodara, one is Rungta in Bhilai. We are looking for more partnerships with the engineering institutions because the engineers are one of the most stressed along with the HCPs and HCWs. And we are looking forward to, because when we want to do a study, and even if it's a blind study, we need partnerships with institutions that are willing to bring these qualitative changes in the students' lives. The institutions that I mentioned, Rungta and Neotech, they had the philosophy of bringing a holistic health to their students as well as academic growth. And I am
Please
very
unmute your
much
microphone
open
if you're
to
not
conduct
talking,
these
please.
studies. We have done studies with athletes. We have
Naresh Pandaji,
done partnerships
please mute
with
yourself.
various government agencies in Africa. And we are really looking forward to partnering with institutions to do these studies. The studies have started. The data is being collected. And within a few months, when we have something tangible, we will submit it in peer-reviewed scientific journals. But as I said, we are still looking forward, because we have to understand, the brighter the student, the more stress they have, because then they put themselves in a position, they start to experience the stress of perfection. They are harder on themselves. So I think IIT is probably one of the institutions that produces the brightest students, but as I said, that is the curse of brilliance. The brighter the light, the darker the shadow underneath. So if IIT is open to bring these interventions and do a pilot study, me and my research team would be extremely honored to do so and give my services. Definitely.
Thank you.
Yeah, we will connect you to-
Kananji, you are.
And
I
as
know
I
you are
said,
at the
this is
forefront.
all software based. So it doesn't matter where we are in the world, we can be together through software. Yes.
Thank you, Ishanji. Kananji, you are at the forefront, and you have done some amazing work by creating spoken tutorial and bringing education to masses. You are part of our wheels. You are on the board. You are chairman of the Education Council, and I think you can bring about this. And as Ishanji said, students who are preparing to get admitted in IIT, or for that matter, government medical colleges, are the highest stressed students with the highest incidences of anxiety, depression, and even suicides, because if they are not successful. Kananji, if you want to say a word, you can unmute and come online.
Dr. Shah, I cannot agree with you more. So it'll be really exciting if this can overcome the problems that our students have. Thank you.
Thank you.
For everybody's
Pradeep
benefit, everybody's benefit, Professor Kannan Modgalia is professor at IIT Bombay and he's a board member of Wheels. And Ishanji, we will connect you to him so that the possibility of doing further studies with certain specific sets of students, maybe from IITs, can be taken further. So both of you are involved with Wheels and we will connect both of you together so that you can take this forward. There's another question which has come from Bo Subbarao. Mr. Subbarao, would you like to unmute and ask the question? Mr. Subbarao,
Yes, sir.
please go ahead.
Hi. I'm a psychiatrist by trade and training. And it is very common to we recycle the ideas about drug addiction, alcohol, things of that sort. I think there are fundamental issues that are going on throughout the world. I think the world is much smaller than when I was born many years ago. I think that like Dr. Ishanandji said, and everybody is saying that with the technology, we can reach masses. But I think in India, we talked about actually IT professionals come from India, but we haven't really reached the masses, to tell you the truth. I think that's why you are actually doing this, which is very important work that you are doing. But to do this, we need to reach the children, because people already, I think by the time they are in their 20s, they are more focused on making money, making a living. They are not really interested. I think that there is certain self-interest is the most focus, but we are talking about changing the infrastructure.
So can we request you to put your question, Dr.
Right.
Subbarao?
I think my question already, I put it in the question.
Yeah, if you can put it very briefly.
That I think when are we going to start education about yoga, meditation? And I think people are quite sensitive about this as religious or this or that. But yoga is proven, yoga, meditation is proven that there is nothing religious about this. This is a basic lifestyle living across the world. And I think in India, it is taken for granted. And also healthy lifestyle, dieting and growing your own vegetables and green revolution. These kinds of things are simple things. I know my friend Bindu was talking about reimbursement and some of those issues. But I think for many of us in practice, that is an important issue here. But I think beyond the reimbursement issue, we need to think about this part of lifestyle. And I think that's where I'm hoping that you can tell us whether you think it is important to start this at very early in people's life and focus on that education and infrastructure building at a psychological level. Because many people, as a psychiatrist, I see, they grow up with no coping mechanisms.
But in the interest of time, Dr. Subbarao, I think we will
Yes.
just have to request Ishan Shivanandji to respond. The
Sure.
question is, when is the government of India going to introduce yoga, meditation, nutritional education, and organic farming concepts in schools with practical application? I think that'll help reaching rural India. So
I don't know, sir. How
Yeah.
will I know what the government of India will
okay,
do?
thank you very much.
Yes.
Yeah, in the sense that I guess this is, yeah, please.
However, if I may interject,
Yes.
Wills Global is working with IIT chapter to create ideal school and garden and other activities whereby we
Eco-farming
will
initiative, yes.
or whereby we will also introduce health aspect and along with health aspect, our health council, our initiated program of telehealth is going to bring in the mental health. And when Ishanji's apps are ready, we will train the Sahayak, who will be the resident of the village. And through him, we will conduct the classes and other thing for the villagers. So taking this to the last mile at the doorsteps of the villagers. That's what is missing at the present time. And that is the mission, one of the important goal of health council is to provide access.
And
First
I would
step,
like to
access.
add into what Dr. Raj is saying, in the words of JFK, ask not what the country can do for you, ask what you can do for the country. And that's why I like Dr. Raj Shah and the Wheels team, because we do understand the government of India's resources are spread thin. So we are trying our level best to go where the government can't go, and eventually we hope that the government recognizes the efforts of Wheels and then helps us, because when we are talking about schooling, there's private sector and there's public sector. Private sector, they already have a lot of means, and public sector, it has to be via the government. Even if I want to do something or Wheels want to do something, we are, our hands are tied. So we are trying to reach, we are trying, and through our mental wellness initiatives, we will be creating some phenomenal after school programs where through softwares we can help the children. But till that time, sir, I think we should follow JFK and do whatever we can for the
Thank you,
country.
Ishanji. Thank
Yes,
you for
thank you.
putting it in perspective very nicely. We appreciate that. Now I go over to Ashok Batraji, a very dear friend who has also raised his hand. Over to you, Ashokji. Please unmute yourself, switch on your video, and ask your question. Mr. Ashok Batra. Mr. Batra,
Uh,
your hand is raised. Would you like to unmute and ask
Yes,
your
sure. Yes. Thank you. I'll appreciate the comments by Ishanji, and also compliment the efforts of Wheels Foundation for organizing this webinar and their work in India. My question is that this is the amount of stigma attached by the particularly the Indian families. I had a chance to work with the general population and with some Indian families where their dear ones had an addiction problem. My work was when I was a probation officer for 20 years in the Washington, D.C. And I even went and attended the 12-step program also. I was that much convinced there about the 12-step program. And I agree with you, their efficacy or the results are still questionable. How do you deal with? I also went and did the internship at addiction center locally, and in one instance I saw the mother who was a medical student and her son both at the same center, and the mother was giving joints to her son as an incentive to do household chores. Another issue I have is it's difficult to convince people about the disease model of addiction. Thank you.
Here,
you-
just I can answer in 1 minute, sir. I think in perspective of Wheels, we should look not in a specialized mental health care, whereas we are just approaching addiction. We should look at a generalized model of mental health care, where we are looking at bringing at least a baseline of what mental health can be and education. And I think slowly, if we have a strong foundation, we will have the tools and means to even go into specialized mental health care, which is then the substance abuse disorders. But I think these small steps that we are taking will have a butterfly effect of extremely big repercussions. And I think that's what we will do in rural India. But yes, I appreciate your thought, and I do believe everything that you said, and we are working on the same, sir. So
Thank you, Ishanji, for the response. We have one more hand raised, which is Hitesh Bhatt. Hiteshji, would you like to unmute yourself and quickly ask your question? Hitesh Bhatt.
Hi, good morning.
Yes, good morning.
How are you? Let me see if I can unmute my camera. Sorry, I fell on the bike. So I'm working from home today. So only question is, I don't know if you can see me or not, but I don't see a camera settings here. But anyway, regardless, we are at Bud Foundations, actually in 17 countries now. And in North America, we allocate annual scholarship, and then all the general hospitals from Apple to Zebra, everything
So
with
yeah, we saw those, Hitesh in your comments, but here we are, gathered here to see if you have any
got it.
questions. If you
Yeah,
don't,
yeah. So
then
so
we can
question
move
is,
on
no,
to
this
the. Yeah.
no, I agree with you. No, that's
Yeah.
wonderful. So
Yeah.
this is amazing. I'm so glad that A come forward to me and asked me to attend this. And this is really, I agree with all the physicians, especially especially for the entire physician groups. And API really, somebody mentioned about the API. API really needs to take it to the national level, global level. Instead of just having a party and picnic and photo op.
Well, we are not the RP forum, so we
No,
will
I
address
get it.
that
I get it. But
separately. So I think we will move on now. Thank you
okay,
so much for your intervention and
no
comments.
problem. Okay.
Ratan, if you have something to say, or we move to.
Yeah, no, very brief. I
Yes.
think one
Yes.
to the last comment from Bhartji. So
Yeah.
certainly we have the Health Council, and Health Council is the forum for others to engage. So for both Dr. Subbarao as well as Bhatt, it will be welcome addition. So that way we can take the message to the RP community. But more importantly, as Ishanji was saying, we are indeed prioritizing the Eco School program, which is meant at the middle school level to bring the holistic education, which combines environment, climate, health, nutrition, and hands-on learning for the kids at that stage. So I think that is absolutely a program which will help in the direction we are thinking, and we would love to have more participation from you and others to scale that program.
Thank you so
all.
much. Back to Raj
Sorry.
Shah.
Thank you, Pradeep ji. Last 2 minutes of our webinar. First of all, let me thank you all the participants for making it a lively and interactive experience about this very important subject. I want to thank Ishanji, Ambassador Kapur as speaker and as moderator, and some of the panelists, including Dr. Bindu Kansupada, Ratanji, who just came, who is the Vice President of Wills. I know at the background is our President, Suresh Shinoy, who is I call him the engine of the Wills, who keeps us moving. I want to thank you all. Thank you, audience, for this amazing experience of last 1.5 hours. In the light of what we said, and one of the most important things that we need to take to villages, the important step that Wills Health Council has taken, and our goal of 10,000 sites, telemedicine site, because we are not going to be able to provide healthcare providers in every village. Even the government primary health centers, only 30% are staffed with doctors, because once educated, even if those people are from village, they do not want to stay in the village and to raise family. So we will have to depend on technology, health. We have to depend on telesystem in many ways to bring this healthcare at the doorstep of villagers. And to do that, we have created this simple but very effective model, the HEART model, healthcare easy access for rural community via telemedicine. Each center is a self-sustaining, scalable. We need $1,000 for each center. I want to create our goal of 10,000 centers, which will allow us to take care of 100,000 patients a day, translating to 25 million patients a year, every year and year, without any further donation, because it will be self-sustaining by collecting small fee. So my appeal to all the listeners, to your network, to your friend, please help us, please donate to have our goal achieved. A quick reminder, to our upcoming webinar in 2 weeks on 10th September at the same time, 11 a.m. EST, on how our transformative solution called Spoken Tutorial is for educating IT skill to rural masses. Professor Kanan Mugdulia will be giving this webinar. You briefly heard for a minute he was on, and a link to today's event and the recording will be on our website, www.willsglobal.org. And that's also where you can donate. There's a donate button. Finally, thanks to all the attendees, thanks to Ishanji, thanks to Ambassador Kapur, thanks to all the panel participants, including Bindu, Ratanji, and the host of this webinar, one who directs the webinar, our Yagya, who controls everybody's microphone and video and the whole flow. We want to thank you and grateful to you. And again, Suresh, under your leadership, and another pioneer, Mr. Hiten Ghosh, all of you are inspirer. All of you make this possible. Thank you so much. Thank you. This will end this webinar of today. Thank you all.
And just for the participants, we will again play all the PowerPoint presentation, which was played at the beginning of the webinar to give you an idea of all the activities. Thank you.
Thank you.
Can I say something? Pradeep? Ishanji. Yeah, I didn't get a chance to speak, but